Hi, I'm Dean Spraja. I'm CEO of Medical Fitness Solutions and the inventor of the Korebalance training and assessment device. I'm going to provide a brief introduction generically on balance and how it relates to the Korebalance. And then that will be followed by a chapter presentation by Ricky McClure, who works with us in the Korebalance training. If you choose to get certified after this introduction, there'll be a 27 question test at the conclusion of my presentation and Ricky's chapter presentation. Upon successful completion of the test, you will be given a certificate of completion. So here we go. Balance is part of our Total Solutions program and a very important part. We look at balance from a fall reduction, orthopedic, pain control, MTBI, etc. There are numerous applications for balance training and assessment within a clinical environment. What we're looking at with the device and generally in assessing balance maladies with individuals, it's based around visual, vestibular, and proprioceptive responses. And there can be imbalances in these responses. But the good news is we can train so that one becomes more dominant than the others, and that allows us to regain our balance. So particularly when we're working with older people, vision many times is compromised, and they have to count more on their proprioceptive and vestibular responses. So I mentioned before, there's a very broad spectrum of medical necessity that you can treat with balance. Fall and fracture is pretty self-evident. Orthopedic rehab, certainly anything to do with neurological issues, including Parkinson's disease, MTBIs, stroke rehab, etc. So typically for medical necessity to be applicable, we require a physician referral and some sort of diagnosis that could benefit from the Korebalance product. The Korebalance is an FDA recognized balanced vestibular product. And again, as I mentioned, there's a very broad medical necessity. Vertigo, when we talk about vestibular issues, vertigo is one of the most popular ones, and there are several different ways that vertigo manifests itself. BPPV is probably one of the most common, and that's something that needs to be diagnosed and then worked on with the Korebalance training and testing device. Meniere's disease is another issue that affects balance. It's less common than BPPV. But you do get sudden feelings of vertigo, so sometimes it's confused with the symptoms of BPPV. But along with that dizziness, you get some hearing loss typically that comes and goes, and then you get tinnitus. You get some buzzing, ringing, whistling in the ears. So it's a little more specific to vestibular as well as having the dizziness. Other things that can cause vestibular issues are migraines, and then acoustic neuromas, which are a growth on the nerve in the inner ear. I'm going to highlight some of the things as we go through this overview that will be discussed in the certification questionnaire. And then generally with neurological, there's all types of ataxias and dizziness issues that cause lack of coordination or tremors, poor balance, etc. And the Korebalance is appropriate to treat these as well. Concussion is more and more discussed, particularly in the athletic environment, but also we find with the elderly, sometimes this diagnosis is missed because we look at the orthopedic issues with a fall injury. But many times an individual will hit their head either on the way to the ground or on the ground based upon some weakness in the neck. So we can assess and baseline and train and test the MTBI as well as with athletes. We love to get a baseline with athletes that are in a contact sport environment, and that way we can bring them back to that baseline and assess percentage of improvement or regression relative to where they started. So we talk about fracture reduction more than fall prevention. You can't prevent falls, but we do have a program, and Korebalance is a cornerstone of preventing fractures. And fracture prevention includes balance as a cornerstone, but also strength. The number one indicator of a fall is muscular weakness. And then we have programs we work with trabecular bone density and improving that, and then working on posture and gait as well. So what can we do to improve potential outcomes and avoid potential pitfalls, particularly with the elderly and falls? So balance baseline and testing, examination of drug and alcohol use is useful. An environmental analysis, where you are, is there danger? Are you going up and down stairs, loose rugs, etc.? Strength training, of course, the stronger you are, the less likely you are to fall. And then the gait analysis and training. When we work with Parkinson's patients, and many times with the elderly, it's comorbidities. It isn't just a young person with a knee injury. It's dementia, it's tremors, it's balance, it's depression. And then it depends on what drugs the individual is taking. The average American over 70 years old is on 5 different pharmacological interventions, and how are they interacting? So a lot of things we need to assess, but they'll manifest themselves in a test on the Korebalance many times. Not that we're going to know exactly what that issue is, but we can assess, baseline, and train to improve. New program we developed, and it's in the software, and you'll see it in the chapter descriptions, is our Parkinson's program. And basically what that is we have a cognitive, a balance, and a subjective part of that test. So we want to know where that individual is from a subjective and psychological perspective, as well as where they are from a balance and cognition. And the program is the boxing program in particular is made to really, with these targeted pads, is to challenge cognition with elevated heart rate and balance and repeat sequences, and then throw different sequences in there. What we're trying to elicit is an increase in brain-derived neurotrophic factors. There's really good anecdotal results from boxing for Parkinson's, and what we're trying to do with the Korebalance is quantify those by keeping some variables standard. Neurogenesis. We are seeing neurogenesis take place. Prior knowledge had maybe been contradictory to this, but particularly with a good study that CyberCycle did on brain-derived neurotrophic factors with engagement exercise, we are seeing some neurogenesis, and that's very promising when we're dealing with Parkinson's, other degenerative diseases, and Alzheimer's and dementias. So the modality itself, we've got a biofeedback loop. We've got a accelerometer that feeds position signals to the computer at 100 times a second. And we're looking at vision, vestibular response, and proprioception. So we're combining all three. And we're trying to reestablish those neural pathways. We're trying to teach people through ankle strategies and biofeedback how to improve their balance. And we're able to do that with a patent pending design that allows 360 degrees of rotation and 20 degrees of plantar and dorsiflexion. So we're really working on an unstable surface, but it's an unstable surface that we can modify. We have 15 different stability levels, so we can progress patients with more challenging balance assessments and training. And we provide a patient safety belt, and this is important to acknowledge. And you'll see there it says always with eyes closed. Many times when we have a patient close their eyes, they immediately have a transient a balance challenge. And so to protect the patient and the caregiver, anytime we're doing testing with eyes closed, and those are some of our basic tests as well, we suggest putting on the iliac crest belt. Then we have a variety of different Korebalance products with a variety of different menu-driven software programs as well. So the full-on to the left there on your screen, more than likely, with the two models on it, that's our 22-inch touchscreen. And then we have 19, and then compact units, and then mobile units for home health and athletic training as well. So when we're testing and training, we always want to capture a baseline, and we have several different baseline programs that Ricky will describe to you in the chapter training. And we want to bring the patients back and retest with those variables controlled. But the more we train, it's practice makes perfect. Training should occur as often as possible. So the more we train within a patient's tolerance, the better results we're typically going to see. Ricky will get into a little detail here on calibration, but what we want to do is make sure we've got continuity with the device. We don't want any false positives or negative. And Ricky will explain a little bit on the administration screen. There's an advanced calibration proceeding there, but we only want to use that if the device is moved or there's an air leak, because we don't want various caregivers getting in the admin screens and changing calibration. We want to keep that fairly isolated and used only as needed. And I'll back up one here too. On the test, you may see something about bubble levels, because we use a bubble level because it doesn't lie. If that bubble is in the middle of that level, then that platform is level. And people sometimes say, well, it doesn't feel level to me. Well, if that bubble's in the middle of the bubble level, it is level. Ricky will go through the different screens, but particularly the admin screen where we're adding patients. But this is what the home screen looks like. And then we've added a couple of additional programs recently, including the Parkinson's baseline I mentioned earlier with the PDQ-8, which is a Parkinson's disease questionnaire, and then the modified SITSIB, and then the MTBI. And what we do with the MTBI, basically, we do our Romberg type test and then add a cognitive test to that baseline. We have a couple pass-fail tests, and this question might be on the pass-fail test. It's the modified SITSIB and the limits of stability. So we're not really scoring those. You're either passing or failing. Now, if you fail, we have training programs to improve the pass-fail outcomes. So we'll bring a patient back to maybe a less challenging training session and train them to improve the outcome in those pass-fail tests and give them another shot. We have 220, I believe, game options, which are a lot of fun. So patients enjoy doing this, particularly in a senior environment where you're going to be using the software on a regular basis as opposed to a capitated basis. But a couple of different ways we design these tests. Some are higher metabolic demands than others. The Tux Racer takes a lot of shifting of weight and ankle strategies to perform it well. And then the best static balance and concentration is the golf game, where you need to stabilize, aim the ball, have good static balance, and then make a decision of how hard to hit it. So a wide variety that will challenge patients in a variety of ways, sometimes more cognitive and static, and sometimes more dynamic. Cognition Trainer, we have all kinds of modifications we can make here. So if we have a patient that's struggling, we can make it easier. We can make less boxes. We can make bigger symbols. We can extend the period of time to get it completed. So We do want to bring them back to where we have the variables controlled, but in working on that, we certainly have a lot of viability. And this we're going to work on with, physical therapy, occupational therapy, neurology, stroke, TBIs in senior environments as well. Static test is, Ricky will go over that with you again, but then you see on the right there's a histograph, and that's what you need to remember. The histograph is showing us balance over time, and that'll show us any inconsistencies. Even if the score is low, if we have a transient issue with balance, that will be reflected in this test as well. And then static eyes closed. That's when we close the eyes and we're working with proprioceptive and vestibular function only. And in all these tests, when we have the targets here, you're going to see quadrant scores. And quadrant scores we can use to see balance anomalies. So if somebody is through pain or through some neurological issue favoring one side, one quarter or another, we'll be able to identify that and hopefully be able to rectify that and get more symmetrical balance. So we have a dynamic test as well, and really these three tests that I showed you is the static eyes closed, and dynamic comprise our Romberg battery of tests. And then the modified sit-sib, and this will prompt you to increase the PSI on the device to 15 PSI for the static, and then the perturbed surface at 8 PSI. Again, it's a pass-fail, and you get 3 tries. Limits of stability is a pass-fail as well. And we do have very good training software that'll augment the limits of stability. And then we can modify those targets based upon the size and height of the patients. Contraindications, nausea, muscular weakness, and that means basically you can't stabilize yourself on the device, and advanced dementias. Patients just aren't going to be able to follow instructions. So remember those might be on the test as well. Billing code summaries, again, very broad spectrum of medical necessity. There's also another new one that isn't on here that Ricky will discuss with you is gait. So we do include with the device free consultation with a third-party billing expert that's worked with us for years. So she will be able to guide you or your clients in the best use of this device, how to tier it properly, what the appropriate medical necessity is, and again, how to use this specifically in your area with your particular insurance providers. So next, we're going to go into the chapter session of the certification. So Ricky will go chapter by chapter with the function and modality. And then we're going to go into the test. And the test will be 27 questions on a malleable PDF on the computer. So
this is Ricky with Medical Fitness Solutions. And in this video, we will review the Korebalance features of its physical frame. So I'm going to go ahead and cut the video here. Okay. So right now we are looking at the base of the Korebalance itself. We have our mounting shroud, and then we have the platform, our variable stability platform, that can go from 0 to 15 PSI, so 16 different levels of resistance. This single pivot platform can tilt in any direction up to about 20 degrees of vertical tilt. We also have our exercise band attachment points. We've got about 6 total. And we currently have our safety belt wrapped around the column and through the attachment points for the purposes of this video. You'll note I am holding on to our independently adjustable handrail on this model. It uses a pin lock system to adjust. And then up here we have our Korebalance monitor. Depending on your model, you'll be able to adjust up or down And you should also be able to tilt the unit to expose the USB cords underneath if you need to save any data to those external hard drives. I would like to note regarding the mounting of the Korebalance, some individuals are not so comfortable stepping directly forward, so we can advise starting from the side. I'm currently holding on to the Korebalance handrail right now. While I hold on, I can mount 1 foot at a time. This bladder currently has a pressure of 10 psi. To kind of give you an idea, I weigh around 165 pounds. We can suggest taking the arches of your feet and placing it along the logo. I'm going to lean on it, and you'll see that the platform does not tilt very much at this pressure. So at 15 psi, we can make a very stable surface. As far as stances go, if I want a symmetrical stance, I can use these numbers on the pad here just as a point of reference. So if my right foot is at a 7 and I want my left foot to be there as well, I can do that. Keep in mind everyone has different foot length, so it's going to be a little different depending on your individual. And again, foot placement can be hip to shoulder width apart. Okay, I'm going to go ahead and cut the video. And that concludes our video on the physical features of the Korebalance.